Welcome. Today, we'll be talking about the safest ways to sit after undergoing total hip replacement surgery. I'm Sam, an outpatient rehab professional. I'm excited to be going over this information with you today. But before we begin, please make sure to like and subscribe to our channel. This helps us get notice and incentivizes us to create more informative content like this. A total hip replacement for seniors that suffer from a history of arthritis is a big deal. It requires the removal of the natural joint and a complete replacement of the ball and socket joint. Recovery from a total hip replacement takes several weeks and requires significant changes in daily lifestyle and mobility. Today, we'll focus on how to safely sit after undergoing a posterior total hip replacement, specifically by using hip and lift chairs. These chairs are designed to help patients with total hip replacements maintain their hip angle and avoid dislocation or injury. So, what are hip chairs? Hip chairs are chairs designed for people who have undergone total hip replacements. They are usually higher than standard chairs and have cushions or seats that are angled forward to avoid getting stuck or dislocating the hip joint. On the other hand, lift chairs look like your typical recliner, but they come with a manual or electrical lift option to assist the user into a standing position. This lift feature opens up the hip angle, which is exactly what a patient needs to avoid dislocation or injury. Both hip and lift chairs serve the same purposes when it comes to helping a patient post-total hip replacement. They keep the user seated on a secure and higher surface to ease standing transfers. Additionally, both seating surfaces open up the hip angle to maintain the 90-degree precaution and prevent hip dislocation. However, there are some differences between the two. While hip chairs have a fixed position, lift chairs offer more movement. Depending on the model, lift chairs can provide endless sitting, assistive standing, and reclining positions. When it comes to the costs, hip chairs range from $100 to $1,000, while lift chairs range from $300 to $4,000, depending on the model and features. Medicare provides coverage for lift chairs through Medicare Part B plan or a Medicare Advantage C plan. However, insurance coverage for hip chairs is spotty at best for either purchasing or for rental. Since hip chairs are designed for short-term use, many insurance providers view hip chairs as luxury products rather than medically necessary equipment. Patients should consult directly with their insurance to see if coverage, even if partial, is allowed. When it comes to blending with home furniture, both hip and lift chairs come in a wide variety of framing, fabric, and color. Patients can often choose a chair that blends in very well with the interior design of their home. However, lift chairs often take up quite a bit of space due to their full recline option. In terms of how long they can be used, seniors can use either chair for short-term or long-term purposes. Hip chairs can be used for many years by users who have bad hips or who struggle with standing but prefer to sit in a more upright position. Lift chairs, on the other hand, are designed for users with long-term illnesses and severe immobility. Finally, how easy or difficult is it for seniors to get on and off of hip or lift chairs? The beauty of having the features to open up the hip angle of the surgical patient is that they are already situated in a partial standing position while sitting. This means that caregivers who wish to assist a loved one out of a hip chair do not have to take on the user's full body weight. Lift chairs can bring the user to a full stand, so all the caregiver has to do is place the walker and be on standby to assist with standing balance. So there you have it, folks. If you've recently undergone a total hip replacement surgery or know someone who has, hip and lift chairs can help ease the transition and make sitting a more comfortable experience. Thanks for listening, and we hope you learned something new today.